All right, we are going to talk about some of the basics of giving yourself an injection, whether it's a peptide or NAD or glutathione. These are some of the foundational basics that you need to know. So to begin with, you're going to have a vial and it's probably going to have a cap on it. And that cap could either be like this, and that you would flick off in order to expose the rubber hub and draw it up. Or other vials like NAD will have a metal cap. So this guy's a little bit harder to get off. You could use your nail and flick it up. The other option is to use a butter knife or a pair of scissors, but you can see now I've got that up, and that's going to expose the rubber hub. In order to draw up the medications, you want to always sterilize the rubber hub with an alcohol wipe before you put the needle into it. And so when they've been in your refrigerator, before you get started to drop the medication, always just really clean these thoroughly in order to remove any bacteria. And those are ready to go. The other important point about drawing up medications is that you want to be very careful about not making the needle get dull. So when you draw it up, first of all, let me walk you through this little syringe. There's a cap on it, and then there's a second cap where you have the actual plunger. But back to drawing it up, I like to recommend that you have it on a flat surface and you go straight in. This allows you to do it in one puncture. Next, you invert to draw up the medication and then take the syringe out. So again, you want to make sure you have it on a flat surface. You're going in perfectly straight, one puncture, and then invert. And as you can see, as a solution is coming up in this small syringe, it should be filling the barrel. So you always want to check to make sure that it's filling the barrel. All right, so that's the basics. Now we're going to get into actually using your medication. All right, I'm going to walk you through how to administer CJC, Ipamorelin, which is a growth hormone secretagogue. It is going to enhance your body's natural production of growth hormone. It is administered subcutaneously, that means underneath the skin, and it's typically given in the night, an hour and a half after you've eaten food. The reason why we want to have that protocol is when our body, when we eat, we have insulin, which interferes with the peptide. So the idea is that we've minimized any insulin in our body and the peptide is going to work better. So I'm using this vial, which is a similar type of vial as the CJC for demonstration purposes. You'll notice that it's already a liquid, so you don't have to reconstitute it. You're just going to draw it up and administer it. So all of these vials typically have a cap like this on top. You're going to remove the cap and expose the rubber hub. Once you've done that, you're going to take an alcohol wipe and you're going to clean the hub. That ensures that there's no bacteria on the surface, and then you're going to be able to draw it up. I like to have, going over the needle, you have a small needle here. Usually you're going to be doing somewhere under like 10 to 15 units. So if you have a 50 unit syringe, that's fine. If you have a 30 unit syringe, that also works. But you have to take off both caps. So there's a cap where there's a needle, and there's a cap where there's a plunger. This is sterile, so I'm not going to touch it. I'm going to leave it on a table, and I'm going to go straight in. Keeping that one puncture, I'm going to invert it, and then I'm going to use my other hand to draw up the medication. So I'm looking at the number, and I can see, let's say I was doing 10 units. I've drawn up 10 units, take it out, now it's ready to be administered. So now that you have it drawn up, I'm simply going to just take the needle and my alcohol wipe. I'm going to sterilize the skin, and I'm just going to pinch the skin and go underneath. Once it's in, I can press, and now I've just administered the medication. I'm going to take out the syringe and then just use the alcohol to press on the skin surface. Now you're done. It's simple as that. Keep in mind your protocol may vary. Concentrations change with peptides, so sometimes we change your specific protocol, and that's why it's important to look in the PTP at what the recommended instructions are. Sometimes you'll take it 5 nights a week, 6 nights a week, or even 7 nights a week, and then we cycle them. So you want to make sure that you're following that protocol as well. Sometimes we'll cycle on 8 weeks, off 4 weeks, or another variety would be on 4 weeks, off 2 weeks. So always want to take a look at the instructions and correlate with the knowledge that you have in this video in order to administer.